Today on Connected Wellness for Cancer, we bring you an interview on NexJ Health's cancer coaching program and how it supports returning to work after cancer. We're speaking with Patricia Barrett-Robillard from NexJ Health, and we'll explore how cancer coaching is playing a role in individuals' lives to return to the workplace effectively after cancer. Here's your host, Liliana Jato.
Welcome to our first edition of Connected Wellness for Cancer. In today's episode, we'll be talking about NexJ Health's cancer coaching program and supporting individuals returning to work after cancer. I'm your host, Liliana Jato. Joining us today is Patricia Barrett-Robillard, lovingly known as Patti, a cancer coach at NexJ Health. Patti brings a wealth of experience as a registered nurse with an impressive background in the healthcare industry. Her expertise and compassionate approach have guided countless individuals through various stages of cancer. Patti, we're excited to have you with us on this segment, and we look forward to exploring the significant role that cancer coaching plays in assisting individuals in navigating the workplace effectively after cancer. Without further ado, let's dive right into the conversation.
Hi there.
Hi there. So just starting right off, what is a cancer coach and how is it different from other forms of coaching and counseling?
So maybe I'll just start by saying how it's the same and then talk a little bit about the differences, if that's okay. So cancer coaches are trained health coaches. And so what that means is we have lots of training in supporting clients in setting goals and having a vision and making sustained behavioral changes, as all health coaches do. We are different, as all health coaches are different from counseling or counselors, because with counselors, we think more of therapists who have extensive training in mental health issues and supporting people with trauma and things like that. So it's not to say that those things don't come up in our coaching appointments and that we can't support people with that. But we have a very different approach in how we work with that, and we don't focus more on that, mostly on that. We're focusing on where are they at now and where do they want to go. So making those changes, helping them set goals so that they can move forward to become the person that they want to be. So that's health coaching. What cancer coaches bring to the table, in addition to that expertise, is we also bring an expertise in cancer care, working with cancer patients. So generally the clients that come to us are wanting to make changes or improve their coping skills and things like that, but doing it in the context of a cancer diagnosis. So the coaches bring expertise in treatment options, in many of the short and long-term side effects that they might have, and also the strategies that actually help people cope with those better. We bring expertise in the medications and drugs that they might be faced with. And we also bring expertise in making those changes to have the best possible outcomes, including how to better prepare themselves to returning to normal after their treatment. And that includes things like return to work. So that's kind of what the cancer coaches bring. We also, as cancer coaches, are aware of the stages of cancer, because we know that people, depending what stage they're in, have different needs and different issues. So if they're newly diagnosed, they have different needs than if they're in treatment, or if they're post-treatment, or if they're closer to that return to work stage. And so cancer coaches bring that sort of expertise about what they might expect at different stages and strategies that can help them have the best possible outcomes.
So how does a cancer coach and the client work together?
Well, with all coaching, but particularly important with cancer coaching, we really start with getting to know the person. What's actually happening with them? What stage of their cancer are they in? Are they newly diagnosed? Are they finished their treatment and dealing with different side effects? It's really important to get to know them, not just their cancer and where they're at, but also getting to know them as a whole person. Because if someone, is a single mother dealing with cancer, they have different issues and concerns than somebody else. Maybe it's someone who is dealing with cancer and they own their own business and it's not an option to stop working. Maybe they are supporting another family. Maybe they have all kinds of other comorbidities or illnesses that they're also dealing with, or other struggles. And so it's really important to, first of all, get to know them. So with coaching, cancer coaching, it's almost always starts with a video appointment. So we spend some time really getting to know them, what's going on for them, how is it impacting them? And from that, we come up with sort of some strategies and a plan about what are their biggest needs, what's most important to them right now, given where they're at. Where do they want to go, and what are some next steps or steps they can start to take to make things better? So if it's they have upcoming treatments, it might be coming up with a plan to manage side effects. If they're newly diagnosed, they might have all kinds of different questions about their treatment and making decisions. So what we know as a cancer patient or as a cancer coach is that everyone is different. And I can have two clients with the same diagnosis, so maybe two women who have a diagnosis of breast cancer. And the first one might come to me and say, I don't even know where to start. They're telling me I need these treatments. I need more information. I want to know about the drugs, but I don't even know where to start looking. And so they want help sort of more with information and making decisions. And another one might come and say, oh, I've already decided on my plan, or I've done my own research, but I don't know how to tell my children that I have cancer. And so that's where your conversation goes, and what are the steps that they could do to make that easier. So it really depends on the person. Each one is unique, and how the cancer impacts them is also unique. So from there, so from there, it starts with that conversation and getting to know them, and then we set goals, and we'll do some video appointments, but there's all kinds of other tools that we can use in between too, that we can give them access to.
So you just explained to us how some of the clients have very unique stories and unique experiences. So how does the cancer coaching program address our clients' very unique needs?
Well, I think how we do it, because we offer so many different tools and different ways to stay connected with the clients. So yes, of course, we do video appointments with them, and we work with the clients about how often that might be appropriate, given what's going on in their lives, given the goals they set. Some people you might want to have appointments more frequently. Some you can come up with a plan and wait quite a while. So the client really makes those decisions, talking together with their coach. But the other thing is we have many other tools that we have at our fingertips to work with clients. So if they're working on, say, for example, fatigue, like they're dealing with the side effect of fatigue, which is a really common side effect for cancer patients, we would encourage them to use our trackers that we have, where they actually can track their levels of fatigue, or they can track their exercise levels, which might be helping with fatigue. And then they have that information and that data at their fingertips. So if fatigue's a really big thing for them, or even something like nausea or other pain, other side effects, they can bring that to their doctor and say, okay, I've been tracking this for the last 2 weeks or the last month. Here's how many days I was feeling like a 9 out of 10 for fatigue, or here's how many days I had this kind of pain, or here's the time of day that my pain was worse. And that can be really helpful. So again, not every client has pain, but many of them have fatigue. Most of them would benefit from exercise, things like that. So we have all these great tools. They can track their appetite, they can track nausea, all those kind of things. So those are great tools that are helpful. And again, you choose the trackers depending on what the person's going through. Again, we have a great library. So for clients who want more information, who want to learn, need more, more information about their disease or their side effects, we have webinars. We've got great articles. We've got, sites that they can trust, that have been vetted, and they know is a source of reliable information. And we also have things like workbooks, and we have worksheets that they can do. So for example, often have a client, we have something called their goal setting plan. So they sort of do a little bit of a vision. This is where I want to be 6 months from now. And then it breaks it down. Okay, in order to be there, what do I need to do now? What's my next step? And you sort of do those shorter term goals too. And we really know from the data, but we also know from client experience that when clients engage with those tools, they do much better. So all kinds of tools, and depending on the client, depending where they're at on their needs, we engage with different tools.
Absolutely. So just switching gears a little bit, how does cancer coaching support clients when they're navigating not only life, but also returning to work?
Absolutely. So cancer can have a huge impact on your ability to work. Most people do take a little bit of, have to take time off work to manage the treatment. It's a unique illness because of that. Very few people can work the whole time through the treatment. So again, in that getting to know people, like one of the things is I'm talking to people and wanting to know, that's definitely a question that I ask, right? You're talking about their life. So tell me about yourself. Where do you work? How is that? Are you off on sick leave? What's happening with that? And right from the beginning, we're starting to sort of think about that. Okay, given that you're going to be doing this type of treatment, maybe it's surgery, maybe it's chemo or radiation, maybe it's all three. How does that impact your ability to work? What are your goals in terms of returning to work? And so how can we work together to mitigate some of those side effects so that you navigate through the treatment thinking about the plan to return to work right from the beginning, about, okay, if fatigue's an issue right from the beginning, how do I manage that? Another common side effect for some people can be brain fog, which is, just people with cancer, sometimes they're more forgetful, think they're losing their mind a little bit. So as a coach, we normalize all of the side effects and talk about them. This is what may happen. And if it does, or here are some things that might make the symptoms less or not get them at all, or these are things that will improve them more quickly. So we work with them using all the tools we have so that they can have better strategies to manage the side effects. And then we also, as we're getting closer to that work date, as they're thinking about it, we work on an actual plan about what does their job require? What kind of work do they do? Are there special needs or accommodations they're going to need? So we have these conversations so that it's a plan of action and strategies that help them get there and overcome some of the obstacles they might
Patti,
have.
you previously spoke about some of the physical symptoms that our participants go through. So how does a cancer coach guide cancer survivors in dealing with their physical and emotional symptoms when they are trying to return to work
Cancer
effectively?
coaching again and using that individual approach is we have those conversations. What are the symptoms that you're having and what treatments are you having? So because we know the treatments, we know the likely side effects, and we're asking the person about what is it you're actually experiencing or what we could expect you might experience. That's where the expertise of the coach comes in. And so you can start sort of proactively planning for that, because we do know there are strategies that help with things like fatigue, that help with things like brain fog, which are two of the ones that can really impact people returning to work. So we would be talking to clients about how to get regular sort of exercise into their day. We would come up with strategies even about how to manage your energy, so talking about different strategies, because certain things drain energy and certain things add. So again, the uniqueness of the client, talking about what brings them joy, what brings them energy, and focusing and having an intentional plan to bring more of that into their lives. We work with them on managing their stress levels, because we do know that when people are and cancer is a stressful diagnosis, the treatments are stressful. So again, it's not that they're never going to be stressed, but there are definitely strategies we can introduce: meditation, deep breathing, getting out in nature. We talk to them about what works for them or what could work for them and get them trying that. So again, they're managing to the best of their abilities, even things like having less nausea or dealing with the pain of treatments and that. We talk about things ahead of time so that they perhaps have more strategies so that they experience less of those symptoms and they take less of a toll, and that gives them more confidence returning to work.
So in what ways does a cancer coach empower and build the self-confidence of cancer survivors as they are reintegrating back into the workforce?
Well, when people are returning to work, we absolutely talk to them about a plan. It's got to be intentional. You've got to be, it just doesn't happen. You've got to have a plan for doing that. And one way that can be really helpful, first of all, is we normalize a lot of the worries that they might have, the side effects of fatigue, brain fog. Talk to them about that. We anticipate what some of the common obstacles or struggles people deal with when they're returning to work. And we talk about that way ahead of time so that they have an actual plan to deal with that. So how are they going to manage their energy when they're returning to work? We talk about, that first 4 to 6 weeks when you return to work. And normalize that that's a time of transition. You're seeing all your colleagues again after having been off for 8 to 10 months. You might have new colleagues or a new manager. You might be dealing with new computers or systems, or all kinds of things change in that time. It can be quite overwhelming, but because we talk about it ahead of time, we sort of have a plan for that. We talk about it and normalize that they're going to be extra tired in that 4 to 6 weeks at the beginning, but that's not how they're going to feel forever. So have a plan for that. Make sure that the rest of their lives, like if they know, okay, that's going to be really busy, I'm going to plan less other stressful things in my life in that 4 to 6 week plan. We also talk to them about that return and even practice some scripts sometimes with them about how do you talk to your colleagues, or what do you want to say? Because I have clients who are very private and they say, oh my gosh, I'm going to go back to work and I haven't seen people, and they're going to say, how are you doing? Or what happened? Or what kind of treatment did you have? All these questions. And maybe I don't want to share that with everyone. Or maybe I know I look different because maybe when I left for work, I had long hair, and now I'm coming back and I have that post-chemo little fuzz when I'm going back to work. And it's those first meetings with everyone that people are really nervous about. So we actually talk about that and have a script ready so that they're ready to go. So if someone's asking questions and it's not a person they really want to share with, they've got a couple sentences to say, thanks very much for checking in or for asking. It's great to see you. I had it was a bit of a struggle, but I'm feeling so much better now. And I'm just so excited to be back at work. And how are you doing? What's new since I've been gone? And just switching it. So they go in with sort of anticipating what some of the obstacles could be and having a plan to deal with it rather than being sort of reactive to it. And so that we have found has been really successful. So they feel more confident because there's less surprises for them.
Absolutely. And so what are the ongoing support? Like, is there ongoing support sessions, check-ins from a cancer coach? That way we can ensure long-term success for cancer survivors when it comes to their work-related goals?
So, when you sign up for NexJ, generally people have access to the platform depending on how long they want to sign up for, but they can have it for up to a year or even longer. So they would have access to all the library, the tools, all of the trackers, everything that we've talked about on an ongoing basis. They would have access to the instant messaging, or not instant message, but the text messaging with their coach. And they could have access to video appointments, certainly. And that's very common. What we'll do with clients is often, you might have an appointment before they go back to work, and then we might let them settle in 3-4 weeks and sort of see how it's going. I usually would be checking by message to say, how's it going? And, we might be back and forth. But generally, we would book like a video appointment just to say, okay, well, tell me how it went. What were some of the tough parts, or is there anything we need to be adding in or changing up? So there absolutely some ongoing support for them.
Right. Patti, thank you so much for taking the time to join us and share your insights on the cancer coaching program offered by NexJ Health. Your expertise has provided our listeners with valuable information. To all of our listeners, thank you for tuning in. If you'd like to learn more about our program and how it can assist you or someone you know, please visit nexjhealth.com/cancer-coaching-program or send us an email at coaching@nexjhealth.com. Once again, thank you, Patti, and thank you all for being part of this important discussion.
Thank you.